Bursitis of the shoulder, causes and symptoms. Bursitis of the shoulder is a painful inflammation in the shoulder joint. It is common, treatable, and often heals within months. Rest and gentle exercises can speed up recovery. Bursitis is an inflammation of the bursae. The bursae are small, fluid-filled sacs found near joints. They act as a cushion between moving parts in the joint to stop muscles, bones, and tendons from rubbing together. When a shoulder bursa gets irritated, it becomes inflamed and grows in size. This means there is less space in the shoulder for muscles and tendons to move around, which can cause pain and a loss of movement in the shoulder. Overuse of the shoulder joint, an injury, or chronic conditions such as rheumatoid arthritis can cause shoulder bursitis. This video gives key information about causes and symptoms of shoulder bursitis. Symptoms. Key symptoms of shoulder bursitis include pain around the outside or tip of the shoulder, pain when the shoulder is touched, reduced range of movement in the shoulder joint, swelling and redness around the shoulder, shoulder pain when the arm is raised, such as reaching shaves or washing hair. The pain may become worse at night, especially when lying on the affected shoulder. It may also get worse after the shoulder has been kept still for a while. Shoulder bursitis is most common in the subacromial bursa. This is a large bursa at the tip of the shoulder. It helps with smooth movement when the arm is lifted above the head. If the above symptoms are coupled with a fever, the bursa may be infected. This is called septic bursitis, and a doctor should investigate the situation. Causes and risk factors. The most common cause of shoulder bursitis is repetitive movement or overuse of the shoulder joint. Physical injuries such as a car crash or fall can also cause bursitis. Hobbies that put repeated stress on the shoulder, such as baseball, tennis, and weight training, can cause bursitis. People with manual professions are more prone to bursitis of the shoulder, including athletes, painters, and musicians. Other medical conditions can cause or make someone more at risk for shoulder bursitis. This include rheumatoid arthritis, diabetes, and gout. Recovery time. When bursitis of the shoulder is caused by a physical injury, it can be treated within a few days. Recovery time is longer if bursitis is caused by overuse. It may take several weeks or more to heal, especially if the shoulder joint is still being used. Shoulder bursitis may take longer to heal if other shoulder problems are present, including tendinitis or bone problems. Bursitis can be chronic when it is caused by medical conditions, particularly rheumatoid arthritis. Diagnosis. When diagnosing bursitis of the shoulder, a doctor may ask about risk factors, including medical history, profession, and hobbies. Diagnostic tests can include physical exams. A doctor can often diagnose bursitis through testing the location of the pain, muscle strength, and the current range of movement in the shoulder joint. Radiography. An X-ray does not look at the bursa itself, but it can be used to rule out bone damage or arthritis as possible causes of shoulder pain. This can be very important for choosing the right kind of treatment. MRI scans. An MRI scan can show any inflammation in the bursa or any damage to the bone and surrounding tissue. MRI scans are often not required for diagnosis. Fluid testing. Fluid can be taken from the bursa and tested to rule out infection. This process is called aspiration. Prevention. The key to preventing bursitis of the shoulder is reducing strain on the shoulder joint. The following prevention strategies can help. Warming up and stretching the shoulder before exercising or using the shoulder joint repeatedly. Strengthening the shoulder muscles by using gentle exercises. Building up slowly when starting any new activity that places strain on the shoulder. Taking frequent breaks when using the shoulder repeatedly. Improving posture to keep shoulder muscles active and reduce joint pressure.